Since January 2020, when the first cases of COVID-19 began to emerge, we have been living in unprecedented times in global history. The medical and research communities have taken on incredible challenge of beating back the novel coronavirus, not just in the front lines of hospitals, but in laboratories across the world, working to understand the virus and at the same time to protect health. We're witnessing historic efforts by medical schools around the world to develop and to manufacture diagnostics, therapeutics, and vaccines in record times. As the COVID-19 pandemic surpasses 1 million cases in the United States, we can all appreciate more than ever the value of biomedical research, from the basic to translational to clinical research, but most importantly, the critical role that each plays in our society. For many years, those of us in the research community have continued to make a strong case for sustaining a consistent level of medical research activity. Now, the fact that we can quickly repurpose existing therapeutics and develop and test vaccine candidates in just months rather than years has been extraordinary. The cumulative body of research that has happened over time has been remarkable. Here at the University of Maryland School of Medicine, we are leading efforts nationally and internationally to combat this pandemic across many fronts. We do so with our research and discovery at the core of these efforts. We have been focusing primarily on 3 areas of COVID-19 research. They include testing, treatment, and prevention, with more than 100 individuals doing COVID-19 related research at this time. For example, in the testing area, our Institute of Genome Sciences, as well as the Department of Pathology, have formed a collaboration and have worked together to launch a major new large-scale testing initiative. This program uses innovative robotics, and as a consequence, they're able to expand our research testing capabilities so that we can perform up to 20,000 tests per day. Likewise, our Center for Vaccine Development and Global Health, otherwise known as CVD, has begun testing the effectiveness of antiviral drug, remdesivir. This has been used for hospitalized patients only. As you know, most recently, this worldwide study has actually resulted in significant impact in the hospitalization timeframe, so much so that the FDA has approved the use of remdesivir for treatment of COVID-19 complications for hospitalized patients. CVD has also begun to test an unprecedented therapy as a prevention against COVID-19 among healthy individuals who have been exposed to COVID-19. The Department of Pathology is participating in a national Mayo Clinic study testing COVID-19 patients with convalescent plasma therapy. In the prevention area, we recently became the first nation to begin trial of a new promising experimental RNA vaccine developed by Pfizer. In fact, in the United States, only 2 institutions have actually begun in the leadership of this vaccine prevention trial. The University of Maryland School of Medicine was one of those 2 medical schools. We are confident that these major efforts will continue to contribute to the unprecedented national and global effort to really find a cure for COVID-19 complications. At the same time, we're seeing that many new innovations born out of COVID-19, such as telemedicine and other newly developed research and clinical activities, have been accelerated and will likely become part of how we operate long-term into the future. I want to commend each of you for your interest in continuous learning through the new academy. We look forward to keeping you updated and informed about the critical medical research that is occurring here at the University of Maryland School of Medicine. We wish you all the very best in your continuing medical education studies. Thank you.